So today, I'll be diving into a topic that I felt has been an issue for me personally for many years, and it's something that could resonate with you, though you may not have known what your symptoms mean, or it may not do. But I have seen these symptoms in some of my clients, and it's been something we've been a bit flummoxed by in the past. Now, in this episode, I share facts, research, personal experiences about a bacteria called Helicobacter pylori, or H. pylori for short. Now, it has profound effects on gut health and potentially on endometriosis and fertility. Now, for years, I've struggled with a sensitive, tender stomach that comes and goes, and it's not cleared up. And when I say for years, I didn't have it the first time I was conceiving with Ethan, but it's something that's kind of been on and off since I've had Ethan. Um, I don't know, has it come about? And we'll talk about like how it's come about, but it could be because of nappies. I'm not sure. Now, over the last year, my son has been complaining of a sore tummy and a range of other symptoms that again have come and gone. And he was quite a colicky baby, so he's always had some of those gut issues. So it's not surprised me. And I've been trying to do some things at home with probiotics, that kind of thing. But it's got to the point that after a recent visit to the doctor, and she advised to do a stool test on my son to rule out parasites, because I wondered whether it would be parasites because he kept waking up, being quite awake around a full moon. And apparently this is where they change, parasites change states, basically. I'm not going to go into it. And therefore they can end up suppressing melatonin, increasing your cortisol, and you can't sleep. Anyway, H. pylori was the other thing she was going to look into, and I've completely forgotten about H. pylori. It's been on my radar. I know about it. It just hadn't occurred to me in this situation. And also she's tested for various other things as well. So it kind of led me to dive down the rabbit hole that is H. pylori. And I've been wondering if this could be the missing piece of some of my ongoing health issues, and which I'm going to go on and explain about in this episode. Now, bizarrely, an email with a workshop on H. pylori popped into my inbox on the day I started to dive into this. Now, I'm really at the moment looking into kind of like signs that things are meant to be. And I really do think this was. So I kind of like followed up on this. I signed up to the workshop. It was with Amrita Nutrition, which many of you may know that I get supplements from there, and you can get supplements from there. They're practitioner, really good quality practitioner supplements. So anyway, as a result, I got to meet an amazing guy yesterday called Dilly Kular, who's CEO and owner of, or co-owner of Nuvo Healthcare and expert on histamine. So apparently the leading Nuvo Healthcare, the leading experts in histamine, vitamin D, which is another subject, and also H. pylori. So exciting news. He's agreed to come on the podcast, which is fantastic. He's got his own podcast. Can I be candid? I'll pop it in the show notes. So I really want to get him on here so we can dive even deeper into this subject, because he really geeks out about it, really understands the science a lot more than I have. I'm only going to touch on it. I'm not going to go into like full on depth. And some of the things that he was talking about in his workshop were very eye-opening, and I would love him to share those things. So watch out for that in the coming months. Now, finally, how many of you have got and read my email last week to tell you to re-listen to episodes 10 and 12, because I didn't drop an episode. Life got too overwhelming, and I decided rather than try and be a perfectionist and kill myself over it, I decided I wasn't going to do it. And I thought I'd give you some space, listen to those episodes, and see if you'd also measure your stomach acid. If you aren't on the email list, do check out the link in the show notes, or just email me at lizzie@endofertilityspecialist.com, or comment, for example, in Instagram or Facebook group, and I will send you the link for the at-home stomach acid test, which is quite fun to do. Now, please do remember that this podcast is for educational purposes only. We are, really importantly, we're all individuals, which means we're all different. certain things will work on certain people, it won't work on somebody else. Certain symptoms, it depends on what your history is, it depends what your genetics, it depends what you've been exposed to, will mean different things. So listen to it, see if it resonates, you know, and like I said, when I come on to kind of like treatments, we all react differently to things as well. I'm not a medical doctor, and if you have any questions around this, then make sure to see a doctor or a healthcare practitioner to discuss your individual case. So enough of my waffling, let's jump into the episode. Hi and welcome everybody to the Fertility podcast, where you will be empowered to learn how to thrive and conceive with endometriosis. If you want to understand more about your endometriosis, how it can affect your fertility, and how you can personally take action to optimize your health and life, then this is the place for you. I am your host, Lizzie Alexander, founder of the Fertility Specialist. Join me every Wednesday as I dive into topics that will support and guide you, from knowledge about endo and conceiving to nutrition, lifestyle and mindset, pain management to assisted fertility support, functional nutrition and testing, and much more. Together, we will explore a holistic approach to healing that equips you with a toolbox full of diverse strategies to help you manage your endo and enhance your fertility journey. So sit back, relax, and enjoy listening. Right, let's get started with, first of all, I think a recap of what H. pylori is. I did talk about this in the previous episodes, but here we go. So H. pylori, it's like a corkscrew shaped gram-negative acid-resistant bacteria, and it's really widespread all over the world, interestingly. Now, it lives in the stomach lining. I was trying to show you my stomach there for anybody watching the video, but you can't actually see it. So it lives in the stomach lining and reduces stomach acid, or it doesn't always reduce it, but when it's trying to thrive, it reduces the stomach acid. And it also then triggers cortisol and a histamine release in your body. And it's really very common, with a predicted 50% of the world's population carrying it in 2017, and 20% of that has then gone on to develop gastrointestinal disorders. Now, it can quite comfortably live in your stomach and not have any issues. And this is what's really interesting. And researchers have found that it can actually play a commensal role. This is more kind of like recent studies, that it can be beneficial, and they're learning about what this beneficial role is and, you know, how that benefits us, which I'll come into in a minute. But the thing is, if it starts to lower our stomach acid, so we want stomach acid to break down our foods. If we don't have the stomach acid, we can't break down the foods, we then can't take the nutrients out that we need. So this bacteria will lower the stomach acid if it's in an overgrowth phase, or it might be that your stomach acid has been lowered due to other factors. For example, if you are not eating mindfully, and this is not just like one time, two time, but if this has happened many times for a long, long time, and you're not getting enough nutrients to create the stomach acid itself, you're stressed, you're sleep deprived, various other reasons that can cause your stomach acid to lower naturally. So it might not, and then it might thrive in those conditions if you've got it there as well. And then you will experience undesired digestive symptoms and issues that need to be dealt with. Now, it's really important to have, like I said, this good level of stomach acid for breaking down food, getting these absorbing these nutrients, and also maintaining this healthy gut barrier. So how do you get it? Now, H. pylori can come into your body through uncooked meats, is one way they think, but also, rather disgustingly, is fecal contamination, which is the most common way, kind of indicating that people are not washing their hands. And I have to say, with me, I do wonder, and I have wondered in the past, has it got anything to do with the fact that I did washable nappies, which I thought was being really good for the environment, but then actually thinking about it, has it come from that? I mean, I have since learned that you're supposed to wash your, like literally clean your washing machine on a cleaning cycle with various different things once a month. How many of you do that? So just something to think in the future. I loved the washable nappies, but there is certain aspects around that. And has that caused the issue? Or, to be honest, just having a child and having to deal with poo, to be honest. And it also can pass via saliva. So you can have other family members that have got it. They may not have an issue with it, and then you get it and it develops that way. If you've got a poor diet, particularly low levels in vitamin C, because the vitamin C can help maintain the good stomach acid levels, and this also counteracts any overgrowth. Now, interestingly, there was a study by Aim Masso et al. 2019, and they found it's able to cause several nutrients such as iron, cobalamin, so that's B12, vitamin C, and vitamin E to be poorly absorbed, which then has a strong knock-on effect on your nutritional status. But why do some people get it and not others? Well, that is a really big question and something I will be asking Dilly, but effectively it depends on your health, it depends on your genetics, where you live, where you might be visiting. So one of the interesting things that Dilly was saying in his presentation is that there are different strains around the world. They think about 6 different strains around the world, and also the effect of the different virulence factors that H. pylori release, and if these have an effect on you. So with coming back to like the 6 different strains, you might be living somewhere. So for example, I was living in the UK. I'm trying to rack my brain whether I had these stomach pain issues. I think I did in the UK. I think this has gone on before I went to Oman. But an example would be that I was fine with the strain in that area, but then I'll come over here or go to Australia or go to Africa, and then I don't, my body is not able, it doesn't get on with the particular strain in the area that I'm living. So if you're healthy, it may not be a problem. But if you've had years of eating poorly, quickly, had stress, poor diet, you've got a disease, you flare up from any inflammation, that kind of thing, this could end up resulting in poor health, low stomach acid, and it may end up in this bacteria over thriving and then causing this issue where it didn't before. Now, like I said, I think this has happened to me. And I do think it's had this, ability to turn itself on and off. So this is apparently what happens. It can be on and it can sit dormant, and then it can re-thrive other times, which is why they believe it can come and go, depending on your overall health, and it can also not. So when it's in its dormant phase, antibiotics are apparently not much use on it, which is quite interesting as well. So like I've said already, I think I've had it years ago and it's come back in waves. It's kind of like pain. So it's just below your ribs. That area can be really, really quite tender, particularly after I've eaten, but also times when I've got an empty stomach as well. Now, over the last couple of years, I've had quite a lot of different stresses, from coming over, living overseas, and then different food exposures, different cleanliness maybe, and of course, add on top of that the severe house mold, which is, a huge stress on my body, and then IVF treatment this last year. So whilst I have done my best to look after myself during this, it's quite hard to counteract completely everything that's going on in your body. Even knowing what I've known as well. So something I mentioned before is that H. pylori is now considered to be a commensal bacteria. So what I mean by this is it plays a beneficial role. So eradicating it could also mean taking those benefits away, basically. So apparently it is an ancient bacteria found in Africa, and it helps to manage hunger. So when it's present, it helps to regulate your leptin levels so you don't get too hungry. So studies have found post-antibiotic eradication that leptin has then reduced. So when you have leptin, it stops you being hungry. So if you don't have enough leptin, then you're going to be hungry all the time. And this has been linked basically to obesity. So you would expect that if you start increasing eradication, this is not going to aid in the obesity epidemic. And this then begs the question later on, what should we do with it? Should we completely kill it off, or should we just keep it in check? And I think this question is still not fully understood. I mean, it's the same with, interestingly, the way that you deal with your gut microbiome. Before, it used to be very much kind of go in there, eradicate everything, and then build it back up again. Whereas now, the approach, the kind of more accepted approach, is support your good bacteria. They will outcompete then the bad bacteria. You may need to do some eradication depending on what is there if you've done some tests. But the idea is it's about looking after this diverse community within your body. And if we start messing with certain things, then it kind of tips over the balance. So, you know what H. pylori is, where it lives, and what it can do when it overpopulates in us, i.e., it becomes a pathogen, and that it can also be a commensal, i.e., it has a beneficial role in us. So that is confusing, and the literature is also confusing. And this is something that Dilly brought up in his presentation, is that the literature is confusing, and he dives much more into this, and we can do this in his podcast episode. So next, I want to delve into the connections between the bacterium, endometriosis, and fertility, which is what I and you are interested in. And it's kind of like what I got quite excited about, because I am, at the end of the day, I'm a geeky scientist, researcher, and I do get really excited when I read papers and I'm kind of like go down this rabbit hole. Particularly when I picked up that there were links that have been found in the research between endometriosis and between fertility. So first of all, I'm going to talk about the link to inflammation. So H. pylori is notorious for creating something called ammonia, and then also releasing lipopolysaccharides, or LPS for short. Some of you may have heard of LPS, some of you may not have done. Now, LPS are endotoxins, so they're toxins within us that are released from these bacteria that can then breach the gut bacteria and enter the bloodstream. Now, the creation of ammonia can trigger your mast cells and then the immune system to release histamine, which the whole point of that is to release histamine, because it then triggers the release of stomach acid. Now, H. pylori uses the LPS to stick to the stomach lining on the outside, which causes havoc, such as peptic ulcers and leaky gut. And this is giving a very broad brush overview, and I could give it in much more detail. But the kind of the things to hold on to here are the ammonia. So the ammonia raises when you've got H. pylori, and the histamine, which will come on to the symptoms later, but very much related to histamine. Now, the presence of these lipopolysaccharides stimulates inflammation throughout your body, which then interacts with excess estrogen, which is particularly relevant for those with endometriosis. And not just that, the inflammation actually elevates estrogen as well. So the inflammatory environment created by these LPS can exacerbate endometriosis, exacerbate symptoms, and it may then also hinder infertility, which I'll come on, by disrupting implantation and also sperm function. Now, recent studies have found that women with endometriosis have higher amounts of LPS in the pelvic cavity and the pelvic area. And like I said before, these LPS are produced by gram-negative bacteria. So they're not just produced by H. pylori, but other gram-negative bacteria. So for example, another one, which you may have heard me talk about on previous podcast episodes, is E. coli. E. coli is a species that's found in the gut. Again, it has a commensal role when it's kept in check. But if you don't have enough of not lactobacillus, Bacteroides, the E. coli will basically increase. And again, it puts out these LPS. And when you have too much of these lipopolysaccharides, it causes havoc with the immune system. So the scientists have discovered several factors that can contribute to how endometriosis develops. It's still in question, but one of the theories is around the bacteria, that bacteria is basically getting where it shouldn't be, and then it's triggering the immune system to react, causing an elevation in inflammation. Now, there's certain proteins as well. You might have heard of cytokines, you might have heard of a cytokine storm, which can then interfere on how well the digestive system works, as well as the immune system. Now, problems with how the body processes and responds to estrogen and then disrupts how the body maintains and regulates its supply of special cells. Some of these special cells are stem cells, and various other things that can develop into different types of tissues. Now, it's like having lots of things going wrong all at once. You've got unwanted bacteria causing inflammation, you've got your digestive system issues, you've got hormonal imbalances and problems with your body's repair system. And all of these should be working together, as a dance. However, when they start to go wrong, not just one, but when they're all kind of not working together, they're not dancing together, this is where it causes an enhancement in the growth and development of endometriosis. So back to H. pylori, it's one of these gram-negative bacteria, like I said, and it could be a serious contributor to this LPS production and inflammation. And if this is a long-standing issue, it could be one of the hidden reasons why inflammation's high, because like for me, my diet seems pretty good. My gut health is the thing, like for many of you out there, is the one that seems quite difficult to, can seem quite difficult to deal with, even when you've had tests. And I've had several tests and dealt with things. But for me, and the thing is, of course, your digestive system starts from your mouth all the way down. And actually, your stomach is the thing that you need to get a handle on before you even get into the small intestine and the large intestine. So you can see why I'm excited to understand this more, and why for me, it could be a hidden aspect that I've been looking for and I need to resolve. So carrying on with this endometriosis connection, I've sort of iterated quite a lot of this already, and I will link in the show notes the research that I've talked around, but the research has demonstrated that LPS significantly contribute to pelvic inflammation, and that they may even promote, like I said, the proliferation of these endometriotic lesions. And specifically, LPS activate inflammation pathways. It's getting really techie here, via something called NF-kappa B, which then leads to increased levels of pro-inflammatory cytokines such as interleukin-6, IL-6, and TNF-alpha. Now, this cascade not only intensifies your endo symptoms, but it also creates a really unfavorable environment for conception. Additionally, the bacterial contamination hypothesis theorizes that menstrual blood that's contaminated with bacteria can serve as a source of LPS, which then triggers this inflammatory response to further stimulate endometriotic tissue growth. So you kind of wonder if there's kind of like contaminated blood, where's the LPS making? Is it in the uterus? Is it going to affect implantation? Is it connected to adenomyosis? So what does this mean for your fertility? What research is out there? I mean, all you have to do is Google H. pylori and fertility, and you'll find that there are papers there to dive into. And I've only just started doing this, and I want to dive into this even more. So I found that the presence of H. pylori has been linked to infertility in both males and females. And there is a meta-analysis revealed that something like 55% of patients in an infertility group tested positive to H. pylori, compared to 39% in control groups, which indicated that there was a higher likelihood of infertility with those who were infected. Now, in women who are undergoing ICSI, infection with what's known as the CAG-A positive strain, so this is different names for different strains of H. pylori, it correlated with an increased risk of early pregnancy loss. So early pregnancy loss in those early weeks. And it's one of those things, sadly, for endometriosis, is that women can get pregnant, but then the pregnancy doesn't get further than 5 or 6 weeks, really, really early on. Now, these studies also showed that while overall rates of pregnancy were not affected, there were increased rates of these early pregnancy loss due to elevated inflammatory cytokines like TNF-alpha. And this is why H. pylori is thought it might disrupt these reproductive processes through several mechanisms. One is the inflammatory response. through this increased levels of inflammatory cytokines, which then can adversely affect implantation. Number two is the antibody production, where infected women can develop antibodies that cross-react then with sperm, which then impairs the fertilization element. Number three, we've got sperm quality. So men, it's been found in the research that infected with CAG-A positive strains often exhibit reduced sperm motility and vitality. Now, even more than this, women with idiopathic infertility in the research has shown higher rates of H. pylori infection than those with known infertility factors. That basically means where they don't know what the infertility is, it happens to be that H. pylori is in those particular people. So how important is this in those unexplained infertility cases? So I've talked about some of the techie side. I might have lost you a little bit. So now we're going to get onto the bit, which is what are the signs that you might have H. pylori? So how might you know you have an issue and there is is there a potential for H. pylori? Could it be something else? So beyond kind of like digestive symptoms, lower abdominal pain, constipation, diarrhea, lower bloating, that kind of thing, watch out for these particular symptoms. One is persistent stomach pain or burning. So for me, I find my stomach is sensitive to touch. Occasionally, I might get heartburn, but not particularly. Heartburn, people often think that heartburn is actually too much acid. It can be because you haven't got enough acid. Bloating immediately after meals, feeling really full really quickly, and excessive belching is a really common one. And then the other one is allergic type reactions to probiotics, for example, because this can cause an elevation of histamines from gram-negative bacteria in response to these good bacteria. So this is where you get a reaction quite quickly rather than a reaction over 90 minutes long, because depending on the speed of reaction gives you an indication as to whether the response is coming from your stomach, where your food's going to end up pretty quickly down in your stomach, compared to when it's 90 minutes later, you're going to be talking about the end of your small intestine. And that's where if you get bloating within 90 minutes, it's more likely your small intestine. After that, you're talking about your large intestine. Another big one is unexplained nausea. So for me, this is especially bad before my period. I get it quite a lot around ovulation as well. And the thing with the period, and I have noticed, and it's easy to look back because I've often thought, oh, ridiculously, even though I know it can't be, but in your excitement, in your hope, you hope that it's an early pregnancy nausea. And obviously it's not been. And I realized, looking back at it, they're clearly histamine. It's clearly an elevation in histamine. And this can happen because the week before your period, you get a spike in estrogen. You also have this spike in estrogen leading up to ovulation and then around ovulation. For me also, I have an issue with histamine breakdown. I've got a number of genetic SNPs, which mean that I can't break it down. So if my bucket starts to fill up, if I start eating too many bananas and avocados and the estrogen's higher and my bacteria is playing up and releasing lots of histamine, inflammation's higher, which stimulates the histamine release as well, then it's going to be an issue because I can't break down that histamine. So you might have the same. If you do get nausea randomly, I also found that with the nausea, if I then eat something, the nausea goes away. So quite like early pregnancy, and there is a link there with the histamine, early pregnancy, the pregnancy nausea, there is a histamine element there, but I'm not going to go through that right now. Nutrient deficiencies is the other one. So despite supplementation, particularly with B12, because B12 has to be activated by the stomach acid in the stomach, and if it's not being activated, then you may be having a problem. You may end up having low B12, which then contributes to kind of like the fatigue picture. Funnily enough, I would probably say 80% of my clients have a below optimal B12 and have fatigue. So I'm not saying it's all H. pylori. Some of it is just because the stomach acid is not high enough, and it is one of the things that I pound about to my clients about the importance of mindful eating, getting the right nutrients to create the stomach acid. That's what I think is really important. Sorry, dry throat. So, testing and treatment options. Now, testing for H. pylori can be conducted through various methods. There is a lot of controversy, it seems, around this in the literature. Depends on medical doctors, practitioners, how up they're on this as to how effective things are. So stool tests is technically the most comprehensive. It's not as clear cut as stool test. Depends on what analysis they use. It depends on their labs, various other things. Interestingly, I have had 3 negatives. I've had 2 labs from one place, one from another. They've always been negative, and yet I've had the symptoms, and which is why I've kind of closed that door in the past on it. Oh, I didn't have it. And it was only recently that it's begged the question, were they fully reliable? And interestingly, there was a recent study in 2023 in Dominican Republic that found only 67% effectiveness with positive results in stool tests. And they begged the question, is there a more reliable test method out there? There is the urea or ammonia breath tests. So this is to detect the ammonia that H. pylori produce. And if this is elevated and you have symptoms, then you could say it's clear that H. pylori is actually causing an issue. And some people say this is the case. And this is what I'm going to go and do is I found a hospital close by that does an ammonia test, and I can just drop in. You have to fast, you can't drink more water in the morning, so I'm going to give that a go this week. Blood tests, but apparently it's not entirely reliable. And then the other one is a gastric biopsy, which is the most invasive and really not ideal. So in terms of treatment options, this is a whole separate podcast. There are many different approaches. None of the natural approaches are really 100% effective at eradicating, namely because H. pylori is able to reside in a commensal role in low abundance. And actually, we know that we may want this. So it's not a bad thing that we don't want to eradicate it. Now, the only definitive way to get rid of H. pylori is with a proton pump inhibitor. So this is a PPI, which lowers the stomach acid and then goes in to kill the bacteria. But you need 2 to 3 different types of antibiotics. And now they're thought even 4 different types. And this was one of the sort of mind-blowing things that Dilly was talking about is the antibiotic resistance, which is a really scary thing, not just to do with H. pylori, but lots of bacteria are developing this antibiotic resistance, and H. pylori is definitely one of them, which is why you then have to subject your body to a lot of antibiotics, different strains, a lot of antibiotics. And that's great if it's going to wipe out the H. pylori, but it's also going to wipe out lots of other things in your body. And so the side effects of this is quite huge. And therefore you do have to weigh up what are the advantages of eradicating it completely. Do you want to go this route? And this is something you do want to discuss with your doctor, with your functional practitioner. And it's one of the things that I want to talk to Dilly about because he has got a lot more wealth of information around this. But in summary, one of the things he was talking about is the NICE guidelines are that if you test positive and you're symptomatic, then you should go on something that's called triple therapy. If you're symptomatic after 5 days, then you add in triple therapy and you add in different antibiotics. So in 14 days, so after 5 days, you take antibiotics. Then if you've still got symptoms, you add in another 7 days. And if this is still symptomatic, you add in another antibiotic. So this is like 21 days you've been on it. And this basically results in a constant exposure to antibiotics. Now, due to the antibiotic resistance, this method is becoming, like I said, increasingly ineffective, and this is why they've now brought in quadruple therapy. Now, while medical treatment is often necessary, and I'm not saying it's not, everybody's different, it's just I'm talking about what's in the research, what I am going to do personally. It's always, if you're going to do that, always think about what can you do at the same time that's going to support your body naturally. So it might be that you're going for IVF next month and you really want to deal with this quickly, you know, and then I would definitely say antibiotics is your best bet. But at the same time, support your gut lining, support your body by taking probiotics, prebiotics, postbiotics to support the rest of your gut microbiome. Now, that way you can also provide, so a couple of things that can provide comfort. Interestingly, so for anybody who's watching the podcast, I actually, funny enough, I'm just showing this mastic gum. It is from an island, so it's called Chios gum, and it looks a little bit like frankincense. It's like, sorry, I'm going to make a noise on the podcast. It looks a little bit like frankincense. It's like tiny little things, and you chew it, and that can give you real relief if you're feeling quite sick or sensitive or sore. Funny enough, I just grabbed it when I was over for IVF, and I don't know why I did. It was in the airport, and they said it was something that was native and really good, but it's heavily researched by the World Health Organization. Loads of amazing studies saying how fantastic it is for your health, and one of them is it's very soothing for the gut lining. So some of the other natural reducers of H. pylori include garlic, broccoli sprouts, green tea, resveratrol. Another soothing thing, as well as the Chios mastic gum, is licorice tea. Then you've also got Manuka honey from New Zealand. They say you need at least 10 plus for that. Propolis, and then things that, for example, seaweeds, so foods that are rich in polysaccharides, so fucoidins or fucoids, which are a certain type of brown seaweed, and then also foods high in vitamin C, because vitamin C kind of keeps the H. pylori down because you increase the stomach acid. So fresh fruits, vegetables, and parsley. One thing to note with this, though, and this is why it's really important to talk to your doctor, just to make sure that you haven't actually got a stomach ulcer. So you may find that if you start doing things to increase your stomach acid, so this is where warm lemon and apple cider vinegar in the morning, and then also before you eat, can really help raise that stomach acid. And if that's painful, then you definitely want to see the doctor, because you may have actually developed a stomach ulcer. So I'm about to do, like I said, an ammonium test, or a urea test as it's known, and I will, hopefully confirm what I suspect, and I will report back. It may come back negative, and then I'll be back to the drawing board. But like I said, as I've done 14 weeks of antibiotics as part of IVF last year, I really don't want to go the antibiotic route. So my first step, I'm going to go sort of the naturopathic route. And I'm going to use Nuvo Healthcare's H. pylori protocol. So they've got a really exciting product, which is the world's first medically licensed zeolite. Most products aren't medically licensed, and this is like a binder which binds and detoxes histamine, heavy metals, the ammonia, and other toxic elements. And then also what I'll do after that is a histamine detox. Because of my problem with histamine, and that my bucket's been filling up, and I've kind of got all those histamine elements or symptoms showing that my histamine is quite high. So the time was actually quite great for us, and this is why I was like, signs of the universe. I feel like things are starting to fall in place where I've kind of have a bit of brain block around everything, because if we were going to move into doing another round of IVF, then we'd do it later this summer, and this then gives time to sort that element out over the next 3 months. And what with the surgery and everything else, I feel like I'm kind of like repositioning myself again. Anyway, time to wrap up. If you're experiencing persistent digestive issues with symptoms like we've talked about, that nausea, stomach pain, belching, you have endometriosis and you've been struggling to get pregnant, you've got inflammation, maybe your transfers haven't worked. So in my case, I had 3 embryo transfers, and this makes you question what's going on there, then I would definitely say investigate this further. It's so easy, and I fall foul of this when you're looking at yourself, to lump symptoms all together and just think they're, just associated with the endo and you can't do anything about them, or you're doing everything you can about them. But actually, some of those symptoms can be separated out and they can be another issue. Like they could be to do with the thyroid, they could be to do with specific gut issues. And I need you to remember here that you are your best doctor. If you've had these symptoms for a while and you've just been putting up with them, you don't need to any longer. And sometimes it's about the fact that you've just put up with them and you've kind of just put up with them, got so used to them, you didn't even realize they were there. And I know that I see that with clients where I start delving and going, right, have you, and often I've got questionnaires with a tick box exercise, and they don't even realize that these symptoms are relevant, but they are. So if that's the case, go and discuss this with your doctor, get tested for Hpylori, and it could reveal a significant factor in your well-being and fertility journey. Now, understanding, sorry, I've got a very dry throat tonight. Understanding this connection offers another tool for managing endometriosis symptoms and hopefully improving fertility outcomes. So, key takeaways. What have you taken away from this episode? Perhaps it's symptoms I mentioned as they resonate with you. Maybe it's the fact that you shouldn't ignore our symptoms, lump them together into endometriosis category, or like I said, you'll just put up with them because you're used to them. Always question and listen to your body. I was listening to Dr. Chatterjee's audiobook of his latest book, and I can't remember the title off my head. And he was saying exactly what I say to my clients and I say to myself, which is you are your own doctor. You need to tune in to what those symptoms mean, and tune into the fact that you do have symptoms and your body is potentially whispering or shouting at you. So if you're unsure and you've been to your doctor and you're not getting anywhere, you can always book in for a 15-minute free health review or an Empower Hour. So if you want an hour of my time, you can just pay for an hour of your time and we can go through whatever questions, whether it's a IVF strategy, whether it's you've got a certain health topic that you want to talk around, then we could do so. So, and I'll put the links, as usual, the links will be in the show notes so you can sort that out. Now, next episode, solo episode, I am going to be doing about signs your vagina is not happy. Now, I will be discussing how this impacts your fertility, what testing I recommend, and I've used on myself and my clients, and how endometriosis plays a role in this. And this, again, is a really, really, really important topic. So if you love this episode or any episode, please, 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 I would love it if you left a review. I had a call with a lovely lady the other day, and she said how much she loved the episodes, that she'd found the podcast, and how much they'd helped her. And literally, I'm hearing this is just really helpful to spur me on, because they are very time consuming. I don't currently get paid for the podcast, and I love sharing my knowledge because I am a bit of a geek. I like sharing it. I like knowing that people are listening and they're finding it helpful. And I far more enjoy that than doing social media. I'm trying to move away from the social media, so because I don't particularly like it. So do please leave a review. It really, really helps it. Right. I hope you found this episode helpful. I hope you have a really good week, and I shall see you next week. See you later.